Good morning, Neil here with the Off the Lip Radio Show, and I'm here with my series Who's Who in Santa Cruz, and Santa Cruz Core in Watsonville. Yes, they have a spot in Watsonville along with the lovely one in Santa Cruz that I go to a lot. I love it, and I'm here today to talk to you about the benefits of ketamine with
Jamie.
I'm Dr. Santillano.
Bingo. So we're going to talk about the benefits of ketamine starting right now.
So we're super excited to have Dr. Santillano treat people here with ketamine therapy. And so there's a lot of different types of ketamine, and we're going to talk about how we do it and the different types.
Okay. All right.
So to briefly address the question about the benefits of ketamine, ketamine has been used off-label for mental health. And the reason why I say off-label is because this medication is categorized as a dissociative anesthetic. It was approved by the FDA in 1970. Before it was approved by the FDA, it was used by our troops in the Korean War. They were using it to help people to evacuate or to have on-site surgeries or tolerate the pain that they suffered for injuries.
Okay.
And then it became an anesthetic. In the year 2000, Yale, Mount Sinai had introduced this medication as a potential benefit for mental health because they'd heard about things happening around the country. And so the IV version of medication has been available since 1970. And they've since started using it in other ways, but the IV therapy is the one that is most studied. More than 1,000 universities across the planet have introduced some kind of IV medication to help evaluate what the benefits of ketamine could be. And then people have been using it off-label. One of the people that I trained with was Dr. Wolfson, and he's in the Marin County area. He's been using IM, so intramuscular ketamine. And so the folk that talk about intramuscular ketamine understand that the bioavailability of intramuscular ketamine is a little bit lower than the bioavailability of ketamine used in the intravenous. Because intravenous, it's 100% going into the blood, so there's 100% that's going to the brain, and that's where the medication really has its main effects, is in the brain.
Okay.
The IM, the estimation is somewhere between 75 and 97%, depending on who you ask. But the truth is, we can't really understand exactly how the bioavailability is because of the injection and the potential location where the injection actually goes in, the circulation of an individual. And so when it comes to the types of ketamine administration, the best administration is IV. The next best is IM, and the FDA has approved a nasal spray. It's called Spravato. Spravato is FDA approved for depression. It's also FDA approved for multi-drug resistant depression. And in 2019, this medication was made available by the FDA. It is approved by insurance. You can get this medication through Medicare. You can receive this medication with commercial insurances. I can say that the limitation of this medication really comes to the providers. There's not a lot of providers that provide this medication. In the county of Santa Cruz, if you look on Spravato's website, there's no providers in the county of Santa Cruz that provide the nasal spray. Now, if you go to Monterey County, you can find it in Monterey. If you go to Santa Clara County, you can find it in Los Gatos. So
we're working on doing that here.
there is a potential for the ability of the FDA-approved version of ketamine. And that's something that we would like to be able to provide for people who don't have access to the other types of ketamine.
Okay. Now, the only thing I've heard that I don't hear very much is, along this particular subject, is the negativity of it. And I saw the Matthew Perry video based upon ketamine, how he passed away, and perhaps we can touch on that right now.
I would like to get there. The last version of ketamine that I want to talk about is the oral version.
Okay.
The oral version is probably the most prevalently available version right now because you can go online and find a provider that can send you that medication to your house. And so the difference between the different levels is that has the lowest bioavailability and so the lowest opportunity for real improvement to mental health. That medication at an oral dose is usually able to get you to a, we'll say, meditative state, and that's probably the type that people are using or abusing in the recreational way. And so talking about Matthew Perry was not using this in a recreational way. He was using it to try and escape from his emotional feelings. And he was given this medication by someone who was later dubbed the ketamine queen.
Yeah.
And what the ketamine queen did was she provided this medication for him to take at home, and he was using the FDA, anesthesia version, and was receiving injections from his associate or one of his helpers at his home, private help, and he received this medication and was in the hot tub. And so the main reason why Matthew Perry died was because he drowned. He had enough medicine circulating that he lost his consciousness and ability to protect himself, and he drowned.
Right.
He did not lose his life because he used ketamine. He used this life because he used it in an unethical way.
Right.
He received the medication from a doctor who was not administering the medication, not controlling the dose, and on that day he actually received more than one dose. And so his circulating dose was approaching the doses of anesthesia doses.
Well, he was an addict too, right?
Well, the idea is that ketamine doesn't have potential to cause true addiction in that it doesn't cause a chemical dependence like alcohol and opiates.
Right.
When you stop using ketamine, you don't have a withdrawal syndrome.
Okay.
But people get addicted to the escape.
The emotional escape.
Basically, when people are using substances, it doesn't matter what substance. That substance can be food, that substance can be ketamine, that substance can be alcohol, that substance can be opiates, methamphetamine. It doesn't matter what the substance or the behavior is, because some people use behaviors like gambling, sex addiction, pornography. The current addiction that's affecting a lot of individuals is these screens that we use. We're using these computers to try to escape our emotions at the moment, right? And I know that that's a tough subject for a lot of people because we all develop what I'm going to call coping skills.
Right.
And some coping skills are healthier than others. And when a coping skill gets in the way of your function, meaning that any coping skill that interrupts your ability to connect with people that are important to your life, to connect with your job and your ability to make money, those are the times when we start talking about addiction.
What do you recommend an individual would go to get information on this to see if it will work for them or not work for them? Can they come, is it best with a doctor? Can they look online? Can they do some research?
Well, Santa Cruz Core has a website.
Okay, hang on a minute. Let me put you back on the screen here. I'm sorry about that. Go ahead.
Santa Cruz Core has a ketamine section on the website. We do mental health services, and this is a main one. And then we do a interest call. If somebody's interested, they can do a complimentary call with us. And then we do a ketamine care assessment with the doctor after that, if it seems like it's a good fit. So this is for people who want to really feel better and also work through their emotions and work through whatever the trauma is that they've experienced.
And you have an event coming up, right? A flyer or what was that?
In October. So what we're doing is we're partnering with psychologists and therapists so that we can help help more people in the community. And so we're going to partner with them so that they can learn how we do our retreats, and then we can work with the therapists and their patients.
Is it kind of like a ketamine retreat?
It is a ketamine retreat.
So just that per period, okay.
Yeah, ketamine retreat. Well, they're going to do multiple, we'll have Dr. Santillano doing multiple dosings of ketamine in addition to other therapeutic
And
services.
they can get that flyer on your website.
Yep,
I'll make sure I'll get it on my website, Facebook page today. And the dates of that are?
I think it's October 23rd. It's like the weekend before.
And to sign up, they just call Santa Cruz Core to sign up for that.
Yeah, they definitely can.
Okay, cool.
Yeah.
All right, doctor, we're getting moving along here. And so now we talk about the negative, the positive aspects of it. Can we discuss that?
Yeah, the positive aspects of ketamine are actually quite, I'm going to say, impressive. So I've been treating mental health disorders for more than 20 years as a family medicine doctor. About 10 years ago, I entered the space of addiction medicine, and I continue to provide care for addiction medicine, and that addiction can mean anything. I talked about behaviors, I talked about substances. Well, when I got introduced to ketamine, it's because one of the local therapists, Dr. Fader, wanted to work with someone to do what we'll call psychedelic-assisted psychotherapy. And at the current time, there's a lot of talk about other psychedelics being potentially introduced to the FDA. Last year, there was a proposal for MDMA, and also there's continued work with psilocybin. Those are not yet, we'll say, above ground, but ketamine is. And I think there's a lot of advantages of ketamine compared to some of the other substances. And the main advantage for me is the duration of action. When you use this medication, first, it's a very fast onset of action, and it goes away pretty fast. And that's a big difference compared to some of the other psychedelics that are out there that might last 6, 8, 12 hours. Sometimes you can hear about people having trips that last 2 and 3 days. This medication comes on fairly quickly and it goes away fairly quickly. So the amount of time that someone has an altered state of consciousness is much shorter than some of the other psychedelics. That's one of my favorite benefits. The other things that are really beneficial for this medication is that I've had no medication ever work as quickly as this medication to help people to reduce their symptoms of suicidal ideation. Right? Oftentimes, I have a patient that comes in, they're talking about desire to harm themselves. They even demonstrate interest in harming themselves. They demonstrate behavior because they went to the emergency department of harming themselves. And before, I didn't really have a solution. I didn't have a medication that I can say, man, I can really turn around your symptoms. And so far, we've had some patients that have come to us that have already been on ketamine or started ketamine here at Santa Cruz Core, and their suicidal ideation thoughts disappear after one dose. And then they stay away when they're on some kind of maintenance that helps them to keep their control of their emotional dysregulation.
Okay.
Because the truth about emotional responses is emotional responses are part of our hardwiring, right? We have a small brain, the back of the brain, the cerebellum, is part of our brain that thinks, but the smaller brain, the lizard brain, is the one that processes our emotions.
Okay.
And when those emotions happen, we have developed coping behaviors, and these are coping behaviors that started since we were born, right? We learn coping behaviors from our infancy, because when we have some kind of stress, we look for a response. And so our coping behaviors are really from a young age, developed early. And this medication helps us to maybe repair some of our emotional responses. And what I've heard from people that have started this medication is that their usual dysregulation doesn't happen for as long, right? They can bounce back. They don't have the deep depression. They don't have the deep thoughts that kept them locked into their previous, we'll say distorted thinking. And so it's really been amazing.
Also with the ketamine, what's awesome about it is it doesn't just help with suicidal ideations. And people who take SSRIs, right, depression medication, it can really help with depression and anxiety in a way that doesn't have the same side effects. Isn't that right?
I have had patients who have been on 5 up to 7 medications at this site that were on 3, 4 different SSRIs, and all of them caused them problems. And then they started ketamine, and ketamine didn't give them the same side effects. In this case, it was like sexual dysfunction, and so they didn't feel like they could connect with their partner because they didn't have interest in having sex. And then they were on the medicine because they felt like they needed to be on something. And then they got put on ketamine, and ketamine was more effective for their depression and didn't have the sexual side effects. And so it was a win-win for them, and it was really remarkable.
So if I want to get this, you can get it in the mail. I can get it delivered to my house, correct?
Right, and that's the meditative dose. That's not the as much of the therapeutic dose.
But I want to learn about it. So the best place to learn about it would be Santa Cruz Core. So if I want to get informed about this drug, if it's going to help me for whatever issue I have, I would want to learn about it first before I took it. I don't think I want it delivered to my house and all of a sudden I use it. I don't know what the heck I'm doing.
I don't actually recommend anybody to receive this medication to take at home.
Okay.
When this medication is used at home, this medication is really not used in its most effective ways.
Okay.
All right. We can't optimize dosing when you're using this medication at home
by yourself.
And when you're using this medication, if you're taking it at high enough doses, can cause altered states of consciousness. And when that happens, that can create some fear. And so we often talk about set and setting and how important it is to have the right set, which means mindset, and then the right setting, which means that you're not having a lot of exterior type of stimulus, which is why, in my opinion, it's really kind of scary to think about using this in a party, right? Because there's so much stimulus happening in a party that I personally would not recommend using this kind of medication in a party mode.
Right. Recreation mode.
Recreationally, people use this in a place where they might have a lot of external stimulus, and then sometimes they come out feeling very exhausted or tired or overwhelmed or scared, right? Because they receive too much information. Not only because ketamine actually delivers a lot of information internally, but then they have this external stimulation, and that I think is potentially dangerous.
So what you're saying is you want to learn about it first.
Well, the first thing you want to do is make sure that you're a good candidate, right? There's a couple of folk that I wouldn't recommend ketamine for, and
So
most important.
This is the second video I've done with you about ketamine. So I would still want to sit down in front of you and go, you know, here's my situation, here's my issues, and discuss it with somebody first,
Yeah, absolutely.
right?
Yeah, absolutely. We do ketamine care assessment, and you can talk to the doctor. You can talk to me, and I help to screen to see. Again, this is people who want to work through their emotions, stop being depressed and anxious. This is, like he said, not something that we do, you know, recreationally. This is to like really rewire your brain to help you to exist better in the world.
Yeah, one of my favorite words is neuroplasticity. Neuroplasticity is one of those things that you hear a lot of. You even hear about it with the adaptogens, with mushrooms. All right, you hear a lot of sales right now about trying to get people to have an improvement in their nervous system.
Right.
And what I really like about ketamine is able to work quickly and help people to really connect with emotions that they may not have been able to connect with before, because they're in this constant stress mode, and this constant stress mode doesn't allow you to really think and reconnect. So this medication, if you're using it for connection and not using it to escape, like Matthew Perry, then it could be the right medicine for you. When I don't recommend it is when someone's having psychosis or psychotic episode. Psychosis means that you're thinking or hearing things that other people don't think or hear or see. Right? So those are visual, audio, and then delusional kind of psychosis.
Okay.
And then mania, when someone's having manic episodes, meaning that the opposite of depression, that they're kind of on the up and not in this planet.
So get educated, see if it's for you, right? It may not be for you, right? It may not be for everybody, right?
It's definitely not for everybody.
Right. So just get educated first, and to get educated, you want to contact Santa Cruz Core.
Check out Santa Cruz Core, and we have it on our website under Health and Wellness, the mental health services. And
this video will be on YouTube. You want to go back and watch it. It's on Facebook Live, on Santa Cruz Wave's Facebook page. It'll be on all podcast platforms if you want to just listen to it as you're driving down the road. Once again, Santa Cruz Core, give me the website.
Yeah, santacruzcore.com, and our number is 831-425-9500. You can call and make an appointment.
At any place. So if you call that number, you can make an appointment in Watsonville, you can make an appointment in Santa Cruz.
Yep, and we do online like ketamine care assessments and like interest calls.
And the doctor's available? He's available to sit down and talk to you, right?
Yeah, that's right.
Okay, cool. Thanks, doctor.
Appreciate your help today. The majority of my consultations initially are video consultations.
Okay.
That way we can fit it into your schedule.
Yeah.
And make sure that you can, get the information that you need. I spend during my ketamine assessment more than an hour, which is not your typical time that you get with someone. So I try to really dive into your full history so that we can make sure that this is the right choice for you.
Perfect. Thank you, guys.
Thank you.
Good job.